what experiences need to be uncovered, and what problems are crucial. A textbook he wrote in his mid-30s on the treatment of the problem child attracted wide academic attention and led to a professorship at Ohio State University. There he offered a pioneering course on counseling. Remember that in the late 1930s, the field of clinical psychology, as we know it today, did not exist. Soon as his ideas about therapy crystallized, he wrote a textbook, Counseling and Psychotherapy, which his publishers were reluctant to publish. They would prefer, they told him, a text for a course and a field that existed. Ultimately, Counseling and Psychotherapy was destined, along with Rollo May's book, The Art of Counseling, to play a significant role in the birth of clinical psychology and to shape the future of a humanistically oriented therapeutic approach. Carl Rogers was a hardy warrior who fought many battles, territorial battles with the field of medicine and psychiatry, which tried to prevent psychologists from treating patients, ideological battles with reductionists, such as B.F. Skinner, who denied the centrality of choice, will, and purpose, and procedural battles with psychoanalysts who considered his client-centered approach simplistic and anti-intellectual. Today, a half-century later, Rogers's therapeutic approach seems so right, so self-evident, and so buttressed by decades of psychotherapy research that it is difficult to appreciate the intensity of these battles, or even to comprehend what they were all about. Experienced therapists today agree that the crucial aspect of therapy, as Rogers grasped early in his career, is the therapeutic relationship. Of course, it is imperative that the therapist relate genuinely to the patient. The more the therapist becomes a real person and avoids self-protective or professional masks or roles, the more the patient will reciprocate and change in a constructive direction. Of course, the therapist should accept the patient non-judgmentally and unconditionally. And of course, the therapist must enter empathically into the private world of the client. Yet these were once such novel ideas that Rogers had to bludgeon the profession into taking note of them. His primary weapon was objective evidence, and he was the creative force behind the use of empirical research to elucidate the process and outcome of psychotherapy. His studies of the critical aspects of the therapist-client relationship, empathic understanding, genuineness, and unconditional positive regard, continue to be considered by social scientists as a model of research elegance and relevance. Rogers was joined in his lifelong efforts to create and nurture a humanistic approach to psychotherapy by the powerful voice of Rollo May. Though the two men fundamentally agreed about the goals and approach to therapy, and though both were educated at the Union Theological Seminary, they drew their convictions from very different sources. Carl Rogers from empirical research, and Rollo May from the study of literature, philosophy, and myth. During his career, Rogers was attacked for the supposed simplicity of his therapeutic approach, and many practitioners caricatured client-centered therapy as the method in which the therapist merely repeats the last words of the client's remarks. Yet those who knew Rogers, who watched him interview, or who read his work with care knew that his approach was neither simplistic nor restrictive. It is true that Rogers always proceeded from the bottom up rather from the top down. That is, he first grounded himself in his immediate observations of therapeutic work, his own and others, and generated low-level but testable hypotheses. That was always a major difference between a Rogerian approach and a psychoanalytic one, which drew high-level inferences to construct an untestable theory, which subsequently informed and regulated therapeutic procedure. But it is also true that early in his career, Rogers arrived at several fundamental assumptions upon which his subsequent work rests. He was persuaded of the reality and significance of human choice. He believed that experiential learning was a far more powerful approach to personal understanding and change than an endeavor resting upon intellectual understanding. He believed that individuals have within themselves an actualizing tendency, an inbuilt proclivity toward growth and fulfillment. Rogers often spoke of his belief in the existence of a formative impulse.